Hello, everyone, and welcome to another episode of Move Daily Talks. Today, I'm really excited to welcome to the podcast Dr. Kyle Gillett. I've followed him for a number of years, and what I loved about his approach is that he does this holistic approach to medicine. So looking at the whole person, right? Not just prescribing medications, but looking at the background, looking at the spirit, looking at the soul, looking at sleep and exercise and nutrition. So to me, that's super important. And so I'm really glad that we're going to be talking about that today. His practice also includes preventative medicine, aesthetics, sports medicine, hormone optimization, obstetrics and infertility, integrative medicine, and precision medicine, including genomics. He believes that each human is a unique creation that requires attention to their body, mind, and soul. He uses shared decision-making, I love that, and an evidence-based approach. He also firmly believes that food is medicine and exercise is medicine. Dr. Gillett describes the 7 pillars of health as exercise, diet, sleep, stress, social, sunlight, and spirit. These are more powerful than any medication or supplement. He enjoys spending time outdoors on the farm with his wife, 2 sons, 2 wolfhounds. I'm really looking forward to this conversation today, and I hope to learn a lot. I'm sure that we will. Would you welcome with me Dr. Kyle Gillett? And let's just jump off by talking about your 7 pillars of health. One of the reasons why I decided to start following you, why I've continued to follow, is because I really love and appreciate the fact that this is your angle when it comes to your approach to treating patients, is that you're not just looking at one component, but you're really investigating, asking questions about the whole person. And I think that is so important. We do that at Move Daily Fitness as well. We say we're moving daily in our fitness, wellness, and nutrition. And of course, that wellness covers so many things like you've referred to sleep and stress, nutrition, exercise, different things like that. So I would love to hear how that developed for you. Why did you decide to start with this 7-pillar approach? And if you could explain the 7 pillars too.
Yeah, so the 7 pillars start off with diet and exercise, which are, of course, fitness and nutrition. And then the other ones are encompassed in general overarching wellness. And I came up with these because this is what really helps patients. And this is actually evidence-based medicine, good diet, good exercise, good sleep, and the other pillars as well, which are stress, sunlight, which is just being outdoors, social, which is social health, and spirit or spiritual health, metaphysical needs. Those things are more powerful than any medication or supplement, which are just pills. So that's why I came up with them, is because they help, and I'd like to write prescriptions for them. And it also explains the conundrum of why a lot of people that you see that are going to the gym frequently and eating healthy whole foods and cooking things and having good social connections are much healthier than people who are isolated and that are not doing those things, yet they might be going to a dozen different doctors all the time. A lot of people who go to doctors tend to be the least healthy.
Yeah. Do you find that when patients come to see you, they want to feel better quickly, and so they're looking perhaps for a medication to help them alleviate whatever symptom they're going through? But then when you tell them, actually, let's wind this back, you're going to need to improve your sleep, you're going to need to start exercising. Is that something that they respond well to, or do you find like you get some pushback, or how are people responding to that?
Yeah, there's always one rate limiting step in each person's life. Sometimes that's sleep, sometimes it is diet, but most often it is movement.
Hmm.
And this is why we have something in medicine called active listening, which all physicians are supposed to do, and we're trained to do so through medical school and residency, which really just means we take the time to listen to each complaint, if you will, or each aspect of a person's life and what makes it difficult, and put ourselves in someone else's shoes empathetically
Hmm.
and help them find a solution together in order to improve that. Of course, in the general medical system, In the conventional medical system, you have maybe 5 minutes to talk, so that doesn't really happen. And in the alternative or functional medical system, usually you're going to someone for a specific problem, and it's more similar to going to Walmart and you're just getting whatever the med spa or hormone clinic or
Yeah.
functional medicine clinic, whatever algorithm they happen to follow.
Yeah. Yeah. So you said movement. Is that something that you see across the board that just people are not doing? I mean, that I know that the lion's share of people are not moving daily, right? This is part of why we logoed our company as Just Move Daily, because it doesn't have to be a lot, but I think today our society has just stopped moving and there's just so many, ramifications of not doing that. Is that what you're seeing a lot of?
That is our biggest pet peeve is that a lot of people will go to the doctor and they will get in a diet plan. And there's lots of good, simple diet plans that are mostly prepared for you. So time isn't really a rate limiting step. And they'll even improve their sleep or get tested for sleep apnea or other sleep disorders, but they will just not move. And part of that is social because the things that they like to do are different than resistance training.
Yeah.
And they're different than, finding a movement pastime to last a lifetime that they really like doing. And sometimes it's they've found what they think is a movement pastime. Um, and I'm sure we can both think of lots of examples. We don't necessarily need to name them,
Yeah.
but it just doesn't, it's not enough in terms of improving their metabolic health. It's not a balanced enough form of exercise. Golf would be one easy. I'll suggest that one, I suppose.
Yeah.
That is not enough of a movement pastime.
Right. Yeah. Good hobby. I mean, great, but exactly. And this is why I'm loving pickleball in that's coming, it's growing, it's a growing sport and it's great to see because I know one of those blue zones, Loma Linda, California has that as part of their community sport, right? They really prize that. And we are seeing it just rise like crazy here in Kelowna. So it's interesting to see that is the case. I just did a coaching call in my membership not too long ago on high energy flux and this concept that when you go on a specific diet to lose weight and then you want to maintain without continuing to diet, one of the things that you can do, of course, is increase your movement. And I agree, like people just have become so sedentary. And if we could just begin to incorporate small things like exercise snacks, or I think I heard on Dr. Rhonda Patrick's podcast once, VILPA, vigorous intermittent lifestyle physical activity. So this continually thinking of like walking more aggressively or running up the stairs instead of slowly treading up the stairs or walking quickly from the store to your car, but we just slow down and we lose that, right?
Yeah, that's true. I like the idea of nutrient partitioning. There's these different ideas that trend, for example, the fart walks. But I remember 10 plus years ago, there's a health coach named Stan Efferding, and he would have all of his clients do a post-meal walk. And now there's a whole bunch of different names for that trend, but
Yeah.
it's still the same phenomenon. And it's an easy one to implement that I personally
Easy.
enjoy.
I know, and it feels good to actually get the digestion moving. And yeah, so many good research studies on what happens with the glucose. Can you talk about why that would be something that we could incorporate and just what it's doing metabolically inside of us?
Yeah, so the concept of nutrient partitioning is if you use exercise or movement, even something as simple as a walk, then you are going to blunt the glucose spike after a meal and to some degree the triglyceride spike. And exercise will drive those nutrients inside the cell from the bloodstream without requiring insulin. So when you have less insulin, yes, you have less insulin resistance and prediabetes risk, et cetera, but you also have less insulin binding in the liver. And when insulin binds in the liver, you tend to store up even more glucose, and you also tend to lower a protein called SHBG that helps with hormone stability. So you have more hormone fluctuations. And then you also become resistant to insulin over time. So there's many downstream negative effects of letting your insulin run higher after a meal. Fiber consumption is, of course, another way to blunt that, and protein consumption is another way. And if you do all three of those things, high fiber, high protein, and nutrient partitioning, it doesn't have to be exactly after your walk or after your meal. But if you do this throughout the day, then it has a synergistic effect together.
It's such an easy lever to pull as well. You know, like it's not like we're asking you to go do a heavy, hard hit workout. It's go for a walk after your meal. And I think it's such a great opportunity as well to have those social connections that you were talking about. Like one of the twofers that we always do in my friendship group is we hike or walk and talk, right? Like what better opportunity to get both of those components in than something like a post-meal walk. Okay, great tip there. I love that. You talk about spirit as being one of the pillars. Why is this one important?
Yeah, so this is your metaphysical need. It's if you're thinking about Maslow's hierarchy of needs, it's not perfect, but self-actualization is at the top of the pyramid. After you take care of other things in general, you want to find your life's purpose.
Yeah.
When people feel that their life is devoid of purpose, regardless of what it is, then it does lead to many deleterious health outcomes, physically and mentally. Again, in medical school and residency, this is pretty apparent to us. I think we just forget in the busyness of practice to address this with people. That when someone does not know what their purpose was and they're very sick or dying and they feel like their life is unfulfilled, this has even further very negative outcomes on their mental health and also physical health.
Why? Because there's stress about not knowing what you're on the earth for.
Yes. When someone it is very common, even for people who have not been spiritual or religious their entire life, if they're having end of life or palliative care on their deathbed, if you will, that they
Yeah,
will request to talk to various spiritual um,
leaders.
individuals like priests, which might be very surprising to their family, but it
Mm,
does happen frequently in end of life care.
yeah. Yeah, that's very interesting. One of the things that I've noticed on your podcast is that you're doing a reviews of other people's conversations, which I love. I think that's so great, and you're bringing your insight and your partner James there, your colleague, and you're sort of looking at some of the things that people say. So, what are you seeing trending right now in social media posts that you are wanting to have a say on?
Yeah. The next one that really caught my eye is this trend that's called cortisol face. I don't know if you've seen that one.
I've heard a lot about cortisol issues and it drives me
Yeah.
nuts, but I'd love to hear about this. Go ahead.
People love to talk about cortisol. They often don't
Oh, they
talk about its
do.
binding globulin or free cortisol levels, so the difference between salivary and blood cortisol. But anyway, cortisol face is a trend where you have, you can have two different pictures, or your face looks puffier or more swollen in one of them, and
Oh
then
my
less
gosh.
swollen in the other one. And they say
Okay.
this is because of cortisol. And you can have what we call moon facies if you have a true hypercortisolism, which occasionally happens, but it's a relatively rare medical condition. There's also a spectrum of how high cortisol can be, but a fast shift in cortisol is not the primary driver of face swelling or face looking sunken in. Glycogen retention is actually a more common one. Cortisol is
Okay.
highest in the morning when usually faces are most sunken in. And then as you have more carbohydrates, the day goes on, you have more electrolytes, water follows that. And often face puffiness and water retention will show up actually later in the day when cortisol tends to be very low.
So are people saying that if you have this cortisol face, that you shouldn't be exercising, or are they saying high intensity exercise leads to this? Is that what you're seeing?
I'm not sure what the trend is saying, but there's a lot of different theories behind cortisol and why it spikes up. and how you might want to um, do a variety of different things, often supplements to control cortisol. Not that I'm against ashwagandha or phosphatidylserine or rhubarb or your typical cortisol control supplements, but I certainly think that if your goal is to improve the aesthetics of the facial swelling, there are much more actionable targets.
So can we talk a little bit more about cortisol? What, to me, when I think about what it does in the body in terms of exercise, I feel like that's healthy cortisol. Like, of course, you're going to stress the body during a sprint training session or some heavy lifting. But then it comes down, it regulates, comes back to homeostasis as it should. But then you think of life and the stressors of life. And, even in that book, The Telomere Effect, they did a study on caregivers who were caring for sick or dying children and how much cortisol they had and how it impacted their telomere length. Isn't that the cortisol that we need to be more concerned about and need to be looking at versus the cortisol that is induced vis-a-vis exercise?
Yes, certainly. And you can even take that further and say the increase in IGF-1 and testosterone temporarily during exercise for a few hours is also not what you should be primarily concerned about. If it has any significant systemic effect, it certainly has a localized effect, which you'll benefit from. But if it has a systemic effect, then that's just a bonus on top of what is much more clinically significant. So I would not be concerned about the rise in cortisol during exercise. If your cortisol does not rise during exercise, or if you take cortisol blockers pre-exercise, especially strong ones, then your quality of exercise will be much worse. In fact, a lot of people take caffeine before they exercise because it is a performance-enhancing substance, and that will surely also raise your cortisol even more during exercise, which you want.
Right, right. But this whole myth that cortisol increases belly fat, what are you thinking about that?
Yeah, belly fat or android body composition in general. You think about a beer belly, it's sort of the opposite of lipedema. So cortisol, if you have a true Cushingoid disease, extremely high cortisol for a long period of time, then it's going to have effects in addition to just the cortisol. It's going to inhibit testosterone. It's going to cause you to lose lean body mass. A very similar phenomenon to if somebody takes prednisone for a long period of time. That's why if somebody has to be on prednisone for rare diseases like PMR, then we will screen them to make sure they don't have osteoporosis or sarcopenia with DEXA scans. And so that it's effects that can be downstream to cortisol, but slightly high cortisol is not going to cause you to accumulate abdominal body fat. And that's just, if anything, makes a difference between abdominal body fat and body fat in the glutes and legs. It's the ratio of free androgens to free estrogens.
Okay, let's talk about that because there is going to be a percentage of this audience that says, yes, that's exactly where I accumulate my body fat is in my legs. So can you tell me who would be more prone to that?
Yeah, generally those that are more estrogen dominant or those that are less androgen sensitive. So there's a wide variety of androgen sensitivity. If someone has PCOS that is not primarily insulin resistant, so a more androgen dominant PCOS, then if their testosterone and DHT levels are lower, they're probably more androgen sensitive, and they're probably a lot less likely to have body fat accumulation in the lower extremities. This is what I call pre-lipedema. And yes, there's a whole bunch of different stages of lipedema. Lipedema is basically just the equivalent of a beer belly in the lower extremities, which if it gets hardened enough and scarred enough with enough fibrotic tissue, it's extremely difficult to get rid of non-surgically if it's progressed to the later stages. But yes, if people tend to accumulate it in the legs, the first thing I would say, which is usually what I say, regardless of the question, is get some labs and look and see where things are. Often these are individuals who have had multiple pregnancies, which estrogen
Oh,
levels are extremely high in. And often these individuals have relatively high free estrogen to androgen ratios.
so very important to obviously just go and get these tests done. Yeah.
Yep. One interesting thing to note is you can have a higher body fat percentage and be metabolically healthy if you have more of a gynoid or gynecoid body fat deposition. So if you tend to accumulate fat in the hips, glutes, and legs, as a female, you can be up to around 34 to 35% on a DEXA, which is about 30% on an InBody or a Garmin or Omron, and be considered pretty metabolically healthy.
And
Whereas
this
if,
is, oh, sorry, I was going to say, and this is because the visceral fat is not around the organs then, right?
yes, that's what we think is the case, but there's very strong correlation with less cardiovascular risk if you have less visceral fat and abdominal fat.
Right. Right.
Whereas if
So,
someone has more of an apple-shaped
yeah.
or what you see in a lot of people with PCOS, then that's a higher cardiovascular risk. And a lot of times those individuals have legs that are quite lean.
Yes. Isn't it interesting that that's you have the body that you're born with, and it often is, yes, apple or the pear, they say, or maybe a combination of both. Um, but different strategies then for different body shapes, right?
Yeah, certainly. So my wife certainly tends to have a gynecoid or a more pre-lipedema after pregnancies, or about to finish our third one.
Yeah.
But certainly after pregnancies, you can tell that there's been slightly more body fat deposition in those areas, which is perfectly fine and healthy within a healthy body fat percentage. She's still quite lean, but you can certainly tell.
Yeah.
And then as time goes on and hormones balance out, then there's a bit of redistribution of that body fat. If there's not, if you're not cognizant of it, and if you're like the average American or Canadian, which gains at least 1 pound of body fat every year of their adult life and usually loses lean body mass at the same time, much slower, then those predispositions will become a lot more obvious. And then at some point, usually around 35% body fat for females, those can be pathologic.
So, in terms of a nutritional approach to those specific body types, if someone wanted to reduce body fat percentage, what would be your advice on those two different body types?
That's a good question. What matters more is how much you're exercising. If it's someone that exercises a lot, then especially if it's higher intensity exercise, then they're going to be able to stay insulin sensitive with a lot more carbohydrates in the diet.
Mm,
However, if you're someone who has more of the apple-shaped PCOS predisposition, then those individuals do tend to be better with very low carb diets, or even more specifically, not even necessarily low carb, low glycemic
yeah.
diets.
Okay.
Because then they are spiking their insulin less. And whenever your insulin is lower, you have better hormone stability because you're going to metabolize your estrogens and androgens slower.
Right.
An
Right.
easy way to estimate this is test your SHBG. If your SHBG is under 50, then it would be reasonable to either add more cardio or add exercise of really any type, even very low zones, even zone one, like we were mentioning, or decrease carbs.
Right. Okay. Sorry, what is SHBC?
SHBG is
Oh,
sex hormone binding globulin. So without getting overly scientific,
yeah.
this is probably a good takeaway that I think every female should know, because it is the protein in your body. A lot of it's just genetic. Some people with PCOS have very low SHBG. Some people just genetically have very high SHBG, and they have lower free androgen indexes, and they tend to benefit more from androgen replacement in perimenopause and after menopause But this binds up every estrogen and androgen in your body. So if it's too low, then you have bigger spikes and bigger crashes throughout the
Right.
cycle. And then you're also more likely to have, even with normal androgen levels, because you want androgens for their metabolic benefits and building lean metabolically active muscle tissue and maintaining bone mass, but they're more likely to have masculinization side effects, which we call virilization.
The apple shape is going to, yes, have a little bit of a lower carb approach. What are your thoughts on taking out the carbs completely? I know what I think about it, but I had someone comment on one of my posts the other day when I'm offering this free guide with how to prioritize protein and fiber in your nutrition. And in the comments, she wrote, "This is wrong. No one needs this. You just need to be a frugivore. You just need to you don't need any protein, whatever. This is what people do, right?" It's so ridiculous. But there are a group, I know a lot of people who follow me as well that are on keto or carnivore diet. Again, I know my thoughts about it, but I'd love to hear what you think about it.
Yeah, there are a few specific reasons why a ketogenic diet might be helpful from a health perspective, but it's not necessary in any way from a body composition perspective. And it's often deleterious for your athletic performance.
Mm.
And it is quite difficult to adhere to, and it's painful to start. So those reasons would be some types of
Thankfully.
epilepsy, which is a seizure disorder,
Right.
some types of brain tumors, both benign and malignant, and then some rare types of bowel disease. There's other potential reasons to go near ketogenic as well. And certainly, if someone has mild cognitive impairment or pre-dementia, then if they're already using a hyperbaric oxygen chamber, pre-treating with ketones can be quite helpful.
Okay.
Um, so there's a couple niche reasons, but those things are obviously not common for the average person.
Right.
Incorporating healthy carbohydrates in the diet
Yeah.
is going to help give you glycogen, which is kind of the main fuel source that's preferred in higher intensity exercise. And personally, I am a huge fan of consuming large amounts of carbohydrates when it's needed for exercise. I
Yeah.
just check my fasting insulin and I keep it below about 4, and I'm pretty happy with that.
Yeah. Yeah. I agree with that too. Let's talk about Ozempic. This is the word that everyone is now familiar with for sure, GLP-1. And um, no doubt you're a board certified obesity specialist. Yes, right? And so this is your field. I would love to hear again what your thoughts are on this drug.
Yeah. Despite being the one that coined the phrase Ozempic, and I'm working on a documentary
Oh,
called Ozempic. I
yeah.
kind of took that inspiration from Dope Sick, which was a
Yeah.
Netflix
Yep.
documentary at some point.
Saw that.
Despite coining that phrase, GLP-1s are one of my favorite medications. The way that I think about them is, so more than half of Americans have tried a GLP-1 at this point. Um, and obviously, we have not had more than half of Americans cure their obesity at this point as well. So it is not something that someone can take and it's magic and it just works no matter what. But it is particularly helpful from the standpoint of preserving beta cells in the pancreas, which produce insulin, and it helps insulin work better. A good rule of thumb is if you have prediabetes or diabetes, you would likely benefit from a GLP-1 if there's no contraindication. It is common to see side effects like gallbladder attacks and gallstones come up, but those also can happen when you're just dieting with a very low calorie diet. And that's a good way to think about it. I think it's only something like 5% of diabetics are on a GLP-1, which is a
Oh,
hard statistic to believe
yeah, it's
because it
low.
will likely prolong their life.
Right.
So the people who need it are probably not on it. And then the people who don't need it or who are harmed from it are probably on it because candidly, and again, I'm not sponsored by anyone. I speak very freely. They get it from their
Yeah.
med spas and their telemed clinics and Slim for Life in their gym. Our gym has a GLP-1. I think Hims also has a GLP-1 service.
Wow.
I forget who else does. 23andMe, I think, also does
Oh,
GLP-1. And
goodness.
again, I speak very candidly because I have no
Yeah.
sponsorships. I'm sorry if any of those
Yeah.
sponsor people's podcast or whatnot. But and I don't necessarily think it's wrong to add GLP-1 services to your business, but there is a right way and a wrong way to do it. And yeah, a good rule of thumb is if you have diabetes or prediabetes or significant insulin resistance, which about 60 to 70% of people in North America do, then you may benefit from that, but only with the lifestyle interventions at the same time.
Yeah. So important. Um, Now, I kind of want to dive into this. So you work with patients that obviously could go on a drug like this or not, but you also have one of your pillars as being spirit and soul. And I just would love to hear how that intersects for you because with a previous psychology background I have, when I work with clients and when I was a personal trainer, that would be a big approach for me as well, is like they would come and say, oh, I just want diet and exercise. If you just give me a diet and a plan, then I'll follow it and be different. But for me, they would tell me their backstory because I would always ask, like, what precipitated this? How did this start? What was this trigger, right? And think about what led up to them being overweight. And the story
Mm.
was always huge. It was always so impactful. And I thought, it doesn't matter if I give you a diet and exercise, that will not be the solution here. Or you might be able to sustain it for a short period of time, but then you won't be able to. And so this is why I thought with your 7 pillars, it's so important to open up Pandora's box and take a deep dive into what triggered it or what started it in the first place. And yes, it could be lots of genetic factors as well, right? I mean, okay, maybe not. Well, some, and or it's trauma or it's, upbringing, environment. And so let's talk about that because I think this is where I get angry when I see people in comments kind of saying to people who are obese, oh, just, you know, why are you not dieting and exercising? Anyone can do it. If I can do it, you can do it. And there's just so much more to that. And I'd like to talk about that because I think it's important.
Yeah, the spiritual and mental components are vitally important. I would say the majority, if not more than 90% of individuals who are morbidly obese, who have the very severe obesity, they have all of the things. So they have a history of trauma and the
Yeah.
genetic predisposition, and the diet and exercise are off, and they have the insulin resistance, and it, they check all the boxes. So in order to get the best chance to improve them, then you also want to address all of those boxes. And not everybody has to do it in the same way. I think there's lots of good ways to address spirituality. In fact, I think psychedelic assisted therapies are one interesting way that people are doing them with ketamine and other things. And we recently released a podcast kind of talking about the benefits and detriments. I have never done psychedelics or whatnot, although I am a Christian, as I mentioned on podcasts. And I'm even getting trained in soul care, although I guess I've done it for 12 years practicing medicine anyway. Some people have the personality or willingness to listen to where they can meet a stranger and then soon that individual is telling him or her their life story and essentially asking for advice. And occasionally, as you mentioned, when someone comes to their physician, they just want a pill. And sometimes they don't know what they want. Um, but common complaints are anxiousness and stress. And those can be certainly addressed from a physical, mental, and spiritual perspective.
I listened to your podcast on the psychedelics because I have done 2 of those journeys myself. Lots of our really good friends are therapists, so we're in that realm.
Hmm.
And I did do a psilocybin assisted therapeutic journey, and yeah, it's not nothing. I'll tell you that. It is not nothing in terms of exploring your past and really learning to let your wise self be the loudest voice.
Hmm.
And I think when I think about people who have obesity, Any sort of addiction, right? It could be alcoholism or drugs or shopping or exercise, whatever. But there's moments where we all try to find something so that we don't have to feel things that are uncomfortable, right? So we can just pass over those things and try to comfort ourselves, and we use external things to try and do that. It is a wonderful uh, therapy to explore if it's something that people are open to. Not for everyone, for sure. I also grew up never having done anything like that in my whole life. Like alcohol was the worst of anything that I had ever tried. And so to do that the very first time, I was a little bit frightened, but what the takeaway was, such amazing, profound realizations and changes in the neural pathways. Like it's available to me, these wise words, this knowledge now that I feel like I didn't have maybe previously. It's really available to me when I encounter any situation now, and that was pretty awesome.
Yeah, it is. It also makes you wonder for patients that are being evaluated for things like bariatric surgery, depending on the workup process, more often than not, therapy and counseling is mandatory. And it makes a lot of sense to me that when they do that therapy, potentially augmenting it with a psychedelic therapy, I would not be surprised if in 5 to 10 years,
Yeah.
it is something that's routinely considered for everyone. I'm not sure uh, if you would also think that, or if they would do that in Canada too.
Yeah. Well, it's definitely growing here in Canada. One of our friends runs a group called the Gathering Groups, and they provide, it's group therapy, which is kind of cool too, because so often we do things individual, and there are certain cultures and customs where they are together moving through grief, they are together moving through trauma. They're not left alone, just maybe one on one. And I think there's a real power in that as well, is that community sense, right? That's the social that you were talking about, is let's journey through this together, and try to, move to the other side, basically.
Certainly. Yeah, I like that a lot. And hopefully my uh, advocation for both smart and targeted psychedelic assisted therapies is appreciated. I think it's helpful in a lot of areas, whether it's hormones or therapy or spiritual health, to have voices that have a great diversity of thought. So
Hmm.
perhaps they came from different backgrounds, different socioeconomic status, different countries, different genders, different ages, and people who are both heavily involved in it and people who are not.
Hmm.
So uh, for some things, I'm heavily involved, and for some things, I'm not in the trenches, but I'm observing from a different standpoint.
Yeah.
Um, so you have, maybe someone that's from the coast that, recently came to the country that is, involved in whatever therapy or treatment you're considering. He or she will have a very different perspective than me, who just happens to be a Christian from Kansas who
Yeah.
was homeschooled,
Right.
who is still saying these same things. I feel like when you have people of very different backgrounds saying the same thing, then the public will eventually take more and more notice.
Yeah, I love that perspective as well, because then you're not really so polarizing, right? Like, this is part of what in social media that drives me nuts, is that people have one opinion, and it's polarizing to an opposite opinion, and that's where it feels like everything is dividing, and it just gets fueled and angry, and it's fatiguing for me when I look at that. I'm like, God, I don't even want to look anymore because it's just everyone's so opinionated. But I love that approach of yeah, just getting those different ideas, different mindset, being open, right, to hearing and listening, and then deciding for yourself what's best, after that. I think that's good. Yeah. Well, thank you so much for your insight today. That was very interesting. I'll definitely want to go back and listen to parts of this and write things down. Hopefully, our listeners have done that. But of course, you can catch this on the replay. We have this video out on YouTube, but also anywhere that you find your podcast as well. Dr. Kyle, thank you for your insight. Where can people find you? Where can they work with you? In Kansas, obviously, if they live there, but where else on social?
Thank you. My pleasure chatting. And my main hub is Instagram, Kyle Gillett MD, Gillett Health on all other platforms. And we do have a podcast as well. We're going to reboot it here shortly. So we'd appreciate any listenership or constructive criticism or reviews. We do have a clinic in Kansas and a clinic in Los Angeles as well. And we do take patients from, I believe, 49 states.
So virtual as well? Yes.
Yep.
Okay, great. Awesome. I'll put all those links in the show notes, so be sure to check there. Thanks for listening, everyone, and we will see you on the next Move Daily Talks.